نتقدم بالشكر الجزيل لمعالي الشيخ عبد الله بن محمد آل حامد رئيس دائرة الصحة في إمارة أبو ظبي على حضوره ودعمه للمؤتمر العالمي للصيدلة. We thank His Excellency Sheikh Abdullah bin Muhammad Al Hamid, Chairman of Department of Health, Abu Dhabi, for his presence and his tremendous support in the FIP World Congress Pharmacy and Pharmaceutical Sciences. Now, I have the pleasure to introduce the Chair of the Board Pharmaceutical Sciences, Tatsu Imowa.
Thank you very much. Now, I think we are gonna go into award ceremony. Best Medicine Medal is the highest award given annually to the pharmaceutical scientists who made outstanding scientific contribution to the field and dedication to FIP. This is given in honor of Dr. Eric Hest-Madsen, an eminent past president of FIP, and by generous support by the Association of Danish Pharmacies. I am pleased and honored to announce that the recipient of this award this year is Professor Meindert Danhof of Leiden University. Professor Danhof was born in Groningen, Netherlands, graduated from Groningen University, then did his PhD thesis study on antipylin metabolite profile with Dr. Breimer at Leiden University. After receiving his PhD, he spent a few years as a postdoc in the State University of New York at Buffalo and initiated his study on pharmacokinetics in connection with drug effects. During the 40-some years of active engagement with pharmaceutical sciences, Professor Danhof became widely known for his outstanding contribution to understand drug effects by connecting pharmacokinetics, pharmacodynamics, and disorders in our body. The field is now known as the systems pharmacology, and he, I believe, is the most eminent founder of the field. He is the author of nearly 500 scientific articles in peer-reviewed journals and contributed many book chapters. His scientific outcomes have contributed to effectively develop medicines. So he is also highly respected and appreciated by pharmaceutical industries. Professor Danhof's contribution to FIP has also been significant. He has presented many times at our meetings and served as a committee member. And most recently, he chaired the Program Committee of Pharmaceutical Science World Congress 2017 held in Stockholm. His dedication to organize this Stockholm Congress was really essential in the phenomenal success of the event. So as the chair of Board of Pharmaceutical Sciences, I would like to express my sincere gratitude to him. Professor Danhof, I'm very happy to have you here. Please come to the podium.
Dear friends and colleagues, at this special moment I can't resist the temptation to think of the FIP Pharmaceutical Sciences Conference in The Hague in 1977. I was a first-timer at that Congress, but it was not only that, it was also the very first time that I presented a lecture at an international conference. I will not easily forget. The topic of my presentation was on the excretion of drugs in saliva, and the question that we tried to answer was whether we could use saliva concentrations instead of blood concentrations in therapeutic drug monitoring to adjust doses to individual patients. And that marked and highlighted basically the beginning of our research on individualized pharmacotherapeutics, tailor-made pharmacotherapy. Tomorrow, I will have another lecture at this conference, and I will present the paradigm shift in pharmacology that has led to systems therapeutics. And systems therapeutics are complex interventions that are tailored to individual patients, they are precision treatments, and that target specific diseases. So there is an interaction with the disease. And this concept is already revolutionizing, for example, the treatment of cancer. Looking back, it is good to see how the development from therapeutic drug monitoring and saliva to systems therapeutics shows the enormous progress that has been made in the pharmaceutical sciences over the past years. And I'm very honored and pleased that I have been a part of that development. In that development, I have worked extensively with FIP and in various roles and in various capacities. Not in the least in the Stockholm meeting in 2017. And I think that it is important to realize that as the only global organization on medicines, FIP has been and continues to be a premier platform for scientific exchange on medicines research at the interface of science and practice. I appreciated that I would not be standing here today without the support of many people in my environment. And I'm not able to mention them all, but I would like to mention three. The first that I would like to mention are my two mentors. Their names have been mentioned already, Douwe Bremer and Gerhard Levy. They have many things in common. One of the things that they have in common is that each of them received at a certain point in his career the Heust-Madsen Medal. But there were also differences. Douwe Bremer introduced me in research on drug metabolism and clinical pharmacology. Gerhard Levy put me on the bandwagon of research on pharmacodynamics. And so they created a kind of synergistic combination of skills, to put it in pharmacological terms, to start to study relationships with between pharmacokinetics and pharmacodynamics. In Leiden, I have received the support of many people and have worked with many people in the Department of Pharmacology, 6 senior scientists, 25 postdoctoral fellows, more than 65 PhD students, numerous master students, visiting scientists have contributed to this research and to its success. Finally, I would like to mention my family. My wife Marita, who is with me here today, our children, their spouses, and my grandson, Philip, who is 2 years old now. They have always supported me in my research, but they have also made sure that my research efforts and my work attitude was tailor-made to make it bearable. And the combination has been that we have been to combine indeed a scientific career with a very happy and stable family life. I appreciate that we are very fortunate. Lastly, I would like to conclude with the following. A couple of years ago, I have retired from the university. That does not mean that I am retired. There is a big difference between the two. Having retired means that you finally have time to do other things that you were not able to do before. In the title of the Stockholm conference, we had Future Medicines for One World. That is the theme that I would like to devote my time on from now onwards. Together with FIP, I have worked with FIP. I hope to continue to do it. And thank you very much.
I would like now to introduce the chairman of the board of the pharmaceutical practices of FIP, Paul Sinclair, to bestow the Distinguished Practice Award, Oliver Beyong, France.
Thank you, ladies and gentlemen. It is my great pleasure as the chair of the Board of Pharmaceutical Practices of FIP to be part of this award today to Professor Olivier Bugnon for the Distinguished Practice Award for 2019. Professor Bugnon, a winner, has made a significant contribution to pharmaceutical practice, primarily through pharmacy practice research. His work focuses on the development, implementation, and evaluation of personal-centred and integrated pharmacy services, such as chronic care management programs, interprofessional quality circles in primary care and nursing homes, medication adherence enhancing programs, de-prescribing interventions, specialty pharmacy services, and quality care management and integration of e-health tools. His work is recognised nationally and was highlighted by several publications of the Swiss government when highlighting the advanced role of pharmacists. Professor Bugnon has made a significant contribution to FIP over many years via his involvement with a variety of FIP working groups and committees, principally in the role of community pharmacy practice. More recently, he has contributed and supported the FIP Global Conference on Pharmacy and Pharmaceutical Sciences Education in Nanjing, China, as an organiser, speaker and workshop leader. He is a recognised and passionate researcher supporting the advancement of practice, sciences and education, as evidenced by the 60+ articles published in peer-reviewed journals and numerous posters and presentations given at international conferences, including the FIP Annual Congress. Professor Bugnon has been a FIP individual member since 1996 and became a Fellow of FIP in 2018. Ladies and gentlemen, Professor Olivier Bugnon.
Thank you all. It's a great honor to receive this award. You know, I'm actually a lucky man. I'm lucky to be the happy and grateful member of diverse families who support me on a daily basis. The first is a loving family I built with my wife, Brigitte, for 30 years. We have 2 boys, Benjamin and Thomas, of whom we are very proud, of course. My second family is my team in Lausanne. There are about 55% there, and this is a supportive, innovative, motivated expert team of which I'm also very proud. But my third family is you, the pharmacists throughout the world gathered under the leadership of FIP. I'm a lucky man to have been able to learn from a worldwide perspective and to have shared with many of you our common passion for pharmacy practice and science. You know, I graduated as a pharmacist in 1988. I was 24. At that time, the main question was, do we really need a pharmacist? You know, I graduated as a pharmacist in 1988. I was 24. At that time, the main question was, do we really need a pharmacist? And 2 years later, Doug Hepler and Linda Strand defined pharmaceutical care and thus opened the window to new horizons. I had the opportunity to participate in this transformation, developing, implementing, and evaluating pharmacy services. The role of the pharmacist is fundamentally changing in most countries now, but the work is by no means finished. Our mission is to produce health by a value-based pharmacy practice. Pharmacy services must demonstrate their effectiveness and benefits for the safety and efficiency of the health system. This transformation must be achieved with doctors and with other health professionals, with and for patients, as well as with the integration of new technologies. This is a great challenge for practice, education, and research, you will agree. This award is an additional motivation to continue the journey with you and with FIP, Long Life Pharmacy. Thank you all.
It's now my pleasure to introduce FIP Vice President Eva Tarasami to introduce the 2019 FIP Fellows.
Ladies and gentlemen, this is the 14th year that FIP is bestowing the fellowship on individual members who have exhibited strong leadership internationally in either the pharmaceutical sciences or pharmaceutical practice or both. These pharmacy leaders have been instrumental in supporting FIP in its mission, dedicating their valuable time to FIP, each in their own way. It's my honor to announce these new FIP Fellows, and I ask you to join me in welcoming them to the stage. We will start with Dr. Marwan El Akel from Lebanon. Dr. El Akel is a strong promoter of FIP and a role model for young pharmacists. He has undertaken many activities to promote public health and primary care. He has worked in the refugee camps for many years, and he has also served FIP working groups on harm reduction, ethics, and the competency framework for humanitarian pharmacists. Next, we have Dr. Sylvain Grenier from Canada. Dr. Grenier is the current president of FIP's Military and Emergency Pharmacy section. He has contributed to FIP's pictogram and pharmacologists projects. He's also leading the development of a competency framework for humanitarian pharmacy. I want to name Professor Kurt Hershberger from Switzerland. Professor Hershberger is a former president of the Pharmaceutical Care Network in Europe. His research focuses on services provided by pharmacists in primary care. He has been instrumental in developing the polymedication check community pharmacy service in Switzerland. Dr. Marianne Iway from USA. Dr. Iway is the immediate past president of FIP's hospital pharmacy section and has served as the section's vice president for the Americas before that. She has worked tirelessly to disseminate FIP's Basel statements. She has used her strong influence in her home country to be a PharmaBridge host, and she is currently working on practice improvement projects in Namibia and Pakistan. Ms. Susan James from Canada. Ms. James has been an integral part of FIP's workforce development and education efforts for over 10 years. She has contributed to the successes of FIP's Global Conference on Pharmacy and Pharmaceutical Sciences Education and into pharmaceutical workforce development goals 8 and 12. The next of our new fellows, is Mr. Robert Moss from Netherlands. Mr. Moss is a leader in the hospital pharmacy field and current president of FIP's hospital pharmacy section. He has improved hospital pharmacy development in Africa and in Europe. He is passionate about optimizing health systems by integrating new developments in IT and e-health technology. And then we have Dr. John Pieper from USA. Dr. Pieper is a well-known colleague due to his work in Mexico, Saudi Arabia, United Arab Emirates here, and in his home country, USA. He has numerous scientific publications in cardiovascular medicine and clinical pharmacy development. He serves FIP's Academic Institutional Membership Advisory Committee and is the president of the Academic Pharmacy Section. Have our Swedish colleague, Dr. Lars-Åke Söderlund. Dr. Söderlund is a developer in the true meaning of the word. His work with the project Check My Medicines led to over 200,000 patients over 80 years of age receiving improved therapy. He is the current Congress Program Committee co-chair, and we are now enjoying the results of his leadership here, and president of the Community Pharmacy Section. We have Mrs. Carmen Wynne Howells from the United Kingdom. She is a role model to women and a champion of gender equity. She was the first woman chief pharmacist in Wales and is a member of the UN Commission of the Status of Women. She is also active in FIP's hospital pharmacy and social and administrative pharmacy sections, and she has contributed to many FIP working groups, including on pharmacy emergency management.
We are very honored to have so many awards that recognize the work of our great pharmacy leaders worldwide. Now it's my pleasure to announce the Joseph A. Otis Award. The purpose of this award is to recognize both officers of FIP and individuals who have rendered exceptional and distinguished service to FIP. I am pleased to announce that this year, 2 individuals are being recognized in this way. The first is Mr. Andrew Gray. Please, Andy, join me on the stage. There are few pharmacists who bring more depth and breadth of experience and expertise in global health and global pharmacy practice than Andy Gray. His service to FIP during his almost 20-year membership has included holding office in the hospital pharmacy section, including as president and leading the creation of Basel Statement and the Board of Pharmaceutical Practice, including as chairman and as FIP vice president from 2014 to 2018. And I know that as FIP vice president, Andy was still active in the hospital pharmacy section, continuing to contribute to its success. The contributions that Andy has made to FIP are extensive. In fact, too many to list. But they include devoting his time and knowledge to FIP working groups on ethics, remuneration models, and harm reduction, for which he was instrumental in developing FIP's statement of policy. The work that Andy has done for the World Health Organization has also made a meaningful impact on the health of patients around the globe. He brings a deep understanding of the challenges faced by pharmacy practitioners in the developing world and creative strategies for overcoming them, and I am very, very pleased to give him this Joseph A. Otis Award. And now,
thank you, Mr. President, and thank you everyone for those warm applause. A recognition such as this usually comes at the end of one's career, usually in retirement. I may have completed my various terms as an FIP officer, but I have no intention of stopping yet. The opportunities are still too exciting. Voluntary professional associations are wonderful breeding grounds for leadership as they provide opportunities for pharmacists to expand their horizons, move out of the workplace, and engage in the world of policy, of standards, and of development of their profession. They provide not only the chance to learn, but more importantly, to serve, and through serving, to grow. FIP provides the added benefit of the global perspective, the chance for global connections and enrichment of our understanding of what it means to be a pharmacist and a pharmaceutical scientist. Every possible preconception, every parochial tendency is continually challenged. That is what is exceptional. Tomorrow there will be a United Nations high-level meeting on universal health coverage during the 74th session of the General Assembly in New York. Ensuring meaningful universal coverage is the key challenge facing global health at present, and pharmacy will be key to that effort. Access to and responsible use of quality-assured, affordable, essential medicines will not happen without the active engagement of our profession. Dr. Otis would expect nothing less. Thank you very much. Shukran.